Were your expectations met?
Short answer, no.
How much money do you make in a month? Do you ever feel about like quitting medicine? Because so the way I describe it, it is like a passive form of loneliness. Hi everyone, welcome to Is USMLE Worth It? 2 years after the match. My name is Dr. Manik Madan. I'm currently a resident doctor in psychiatry based in the United States. I'm in my third year of residency, and today I have with myself a very special friend, Ulkar.
Yes.
You want to talk about yourself?
Yes. Hi guys, my name is Zulkar. I'm an internal medicine resident, PGY3, here as an IMG in US.
Yeah, nice.
So happy to be here.
Nice to meet you, Ulkar.
You mentioned before.
Yeah. So in this video, we'll be covering various topics about whether USMLE is actually worth it. Now that we are like in third year of our residencies, we've seen a lot of things that we never knew, and we wish people, whoever is coming down this path, should know about the reality of what it is actually to be like a doctor in the US. We'll be going over topics like why did we actually move to the US, what was our motivation, and once we moved to the US, were our expectations met in terms of the residency perks, benefits, the residency pay, like the residency structure, workload, and like were we actually satisfied in terms of the cutting edge healthcare people talk about, and what are basically the opportunities available here for doctors, such as in career advancements, in fellowship, in terms of different job opportunities, and talk about like our struggles in terms of being immigrants, in terms of maybe, let's say, adjusting to a whole new system and society, a new healthcare system, dating, marriage, in terms of salary and expenses. I think that's something that's very important. And thoughts about like sometimes about quitting medicine, because you'll see a lot of people in the US are quitting medicine. A lot of doctors, like there's a neurosurgeon from MIT who just quit medicine. But then there are so many immigrants out there, immigrant doctors who quit every big position that they have. They quit their residencies, lose everything there to come to the US for opportunities. Like it's such a contradictory world right out there. So it's basically about, is USMLE in the end worth it? So Ulkar, just wanted to start with you. Like, what were your intentions? Like, I know, what country are you from?
I am from Azerbaijan. That's where I went to medical school. That's where I was born.
Why move to the US? Like, why did you come to the US?
Yeah, I guess my answer is also kind of cliche.
Yeah.
I just was looking for better education, better like quality when it comes to healthcare, and I worked hard for this as any other IMGs, obviously, and I was very, in general, ambitious, like highly driven person, and I was looking for the best, and then everybody will say, yeah, of course, US is the best. So I was like, okay, then I should just work for it and get it. And then again, the money was also a big factor. Not gonna lie. I mean, I was like hearing about numbers where like high, especially the attending position salary was very appealing. So I was like, okay, I'm gonna have better quality of life when it comes to finances, as well as I'm gonna learn a lot when it comes to advanced medicine and just live a better life. So that's, yeah.
I think what you've said, I think a lot of immigrants, at least immigrant physicians, in terms of immigrant medical students, a lot of them have the same kind of thoughts. Like a lot of people who come down the USMLE path are very ambitious. Like I'm very ambitious, which is one of the reasons I ended up here. Maybe that says to some narcissism about us. Whatever.
Yeah,
you know,
call it whatever.
Some
I
level,
don't care.
Yeah, some level of narcissism isn't bad, actually. But yeah, just the ambition and just like to practice at the cutting edge of medicine, I think that is something that appealed to me, which is why, like, I actually had a seat in residency that was available to me, right? I could have just joined it earlier, 2 years earlier than I joined residency here. And actually I could have been a doctor like before, or I could have been a doctor here 3 years before, but I let go of that opportunity, right? It was a very renowned institute just because I wanted to come to the US and just be at the best, like train with the best. So I think that was a big motivation. And of course, like the money, while many people will, you know, take the highway and say your money doesn't matter, and I completely get that, right?
Yeah.
But like I would also say there's so many studies that have been done on happiness and money, and we know that the more money you make, at least let's say up to $100,000, right, the more happy you are. So like while many people will say money can't make you happy, that is partially true and untrue. So some amount of money can make you happy, and if it can give you a comfortable life,
Yes.
if you're not worried, right? I
Yeah.
think that improves your quality of life, and you can eat healthy, right? Which
Yeah.
I couldn't at times in my country. So here having that money has made me more healthy and happy in many ways, I would say. So that those were similar aspirations, doing research and just working with the best and being at the top of my specialty. I think that was it. So in terms like when you came here, like okay, you're in internal medicine, were your expectations met?
Short answer, no. So again, I didn't expect like everything to be perfect. I do understand that this is an idea and then perfect. Nothing is perfect, basically. But I didn't expect La La Land. But at least my expectations when it comes to healthcare system was different. I did know that residency is hard. I signed up for this. I actually had different negative expectations when it comes to how hard it is residency, because they were saying, oh, it's gonna be 80 hours per week, things like that. It doesn't happen all the time, just so that you guys know. I know we are gonna talk about this a little bit later on, but work hours wasn't that bad. The thing I was most disappointed about was how the healthcare system is operated here. For example, in my country, again, things are not great. We don't even have universal healthcare. We don't even have everything like systematic. But here, they have the system. It's just so complicated that I later realized that this is on purpose, almost so that people won't question it. It's hard to find flaws when you don't understand something. You know what I mean? So I realized that, and then I saw how sick people are. And I did know that in America, people are more obese, like overweight, like that is an issue. I knew that, diabetes, things like that. But even some of my patients who are not actually, like their BMI is fine, they don't look that big or whatever you call it. It's just they're unhealthy. Like looking at the food we are eating, even I'm not patient, right? I just want to eat something, go to store, and I see the ingredients in them. I see the difference when it comes to Europe and in my country. It's just like a big difference. Like when it comes to how everything is created here, it's just more complicated. It's like you have to put extra effort to make your life simpler. And then again, I am getting off the topic, but it's just everything is complicated. So including healthcare system, and then including the food, including the how things are operated. So that was not as I expected. Yeah, and then just that was the hardest part for me to just adjust, like to, especially as an immigrant, to be like able to understand why is it like that? Why is it like that? Yeah, is it on purpose, or it's hard to figure it out? Or is it just got out of hands? Like now they don't know what to do. So
I heard a lot about this, and I think I understand what you mean by like how complicated it is. Because the insurance systems, like it's just like is beyond comprehension at times, and you don't know what's going on. Which I think because you don't understand it, like it's harder to control things in this. I get that. Like if it's on purpose, I really don't know, or I personally don't think so. What I mean is, like, sometimes I don't think anyone is like trying to actively harm anyone. It's just that things somehow got this complicated, out of hands, and based upon how the structure is, right, in the country, and it just at times just doesn't make sense. I will agree with that. But I think that the US has its own problems in terms of healthcare compared to maybe other countries. And some would argue that these problems are better than like other countries. Some would say that these are worse, right? And that opinion is subjective. But what I think you're getting down to is when you're on the outside, you're a medical student, immigrant medical student, you look at the US and you think, wow, this country is perfect, right? Would you say our perception is a bit skewed?
Yes. Yeah, that's exact. Again, I didn't think it's perfect. And I didn't expect to be perfect, but I do agree. I think things just got out of hand. I'm not saying the food, everything is on purpose. I'm just saying the way the system is operating I think is complicated for for people like us. We are highly educated people, right? Even for doctors, we don't a lot of times don't understand the exact how it is like operated. So imagine being a patient who has no literacy about this. And then, so that's why they're getting into those situations where they cannot take care of their health. So I'm just like pointing out, even as a physician, was hard for me to understand.
I completely agree with that point. It is a very complicated system, and which kind of drives a lot of burnout because you just don't know. Like, and the documentation part is something which many residents like in the US aren't happy with, because a lot of our time goes into that documentation. Hopefully AI solves that. But like we'll see, right? But still, like the documentation part can sometimes take you away from your healthcare in terms of patients, right? Spending time with the patients, which I think it has its benefits, but that is something that I was surprised by is how much documentation is, right? But also not painting it in a negative light. Like the US also has its benefits, right? But like again, the perception of the general immigrant is skewed. They're like, this is a perfect healthcare system. It's not. It is broken in many ways, but it's less broken in many other ways as well, is what we are getting at. So in terms of your expectations, in terms of, let's say, residency perks and benefits like salary, do you think those expectations were met in that regard? Are you getting a salary that's good enough to support you? Do you have enough savings, right? How's that as a doctor?
Again, I believe it's okay as far as, because this is technically still a training they're teaching us. I've learned a lot, so I cannot deny that. So like they were paying me for, at the same time they were teaching me. And again, I am doing a job basically, and then hospital is making money out of that. But still, I believe the compensation is okay. And then it's definitely like you can survive and save money. Obviously, it will depend on your personal preference and like how much of a spender you are, like whether you are really good with money or not. So yes, in America, you can spend like $1,000 in one day and you will be like, boom, gone. It's very easy. But if you are careful, like, you can always save money. And then it's like, I just cannot give one number, but I again think that this money is good enough for like decent life.
How much do you make in a year? I know like every program is different, but like how much do you make?
It goes up every year. This year has been the highest.
How much?
If I'm not mistaken, I think right now it's 68.
Yeah, similar, 68,000. And how much? So you're paid bi-weekly or are you paid monthly?
Monthly.
Okay, I'm paid bi-weekly. Every residency structure is different. So for you, it's monthly, right? So how much do you do you know like how much money do you make in a month in terms of like after taxes?
Yeah, taxes are the big thing, obviously. I'm getting, again, it will also depend on a few other factors, whether you're on visa, green card, things like that. Mine is around 4,300 after taxes.
After taxes every month. And how much do you spend? How much do you save?
I think I am really good with money. I'm not going to be humble about it.
Wait till I tell you how good I'm with
you
money.
are better? Okay. We are competing here.
I'm an Indian, so let's
Definitely, I'm not paying rent.
I'm paying rent, so she wins. Rent is huge,
Yeah, rent is huge, right? But I don't know. I really don't. Probably you win, because you know what? I don't really track my money that much.
Okay, but on an average, like how much do you end up spending? Like on an average, just ballpark.
At least 2,000.
Wow. Okay, so you spend 2,000, and the rest of the like 2,300 is something you save, right? So you're making like 24 grand a year. $24,000 is how much you're saving. Correct?
Yes. Yeah, I will say I save 2,000. Yeah.
2,000.
Yeah, let's just go with the rough number, because again, it depends. I have a cat.
Pets are expensive. Pets are expensive.
And I do care about my health, so I always like try to choose like high quality food, high quality products for everything, like from skincare to everything. Like
preventative healthcare.
Yes,
we're going to talk about
that. Yeah, but so that's what my philosophy is, that instead of spending money when I'm really sick, I would like to spend it before and just, I don't know, I'm a little bit spoiled.
That's good. I think that's the best kind of.
If I had to pay rent, it will be way more.
So it will be way more. Yeah. So for me, I make about $68,000. We are paid bi-weekly, and I generally take home about 2,000 something every so 2,100, so 4,200 in the end after taxes in a month. And my rent is like $550 because I live like I have a roommate.
How did you find that?
I have a roommate, My apartment might have mold. It's like really old,
Okay.
but not the best apartment, but it's cheap. So
Okay.
for 550 is my rent, and then my other electricity bill and my internet bill makes like this go to like about $600. Sorry, 700. About $700 a month of like expenses there. Plus, let's say if I were to go on dates, or I would like to go on like eat with friends.
Okay.
Dates are expensive. I'll be very honest. They can get
If you're as a
50
guy,
as a guy, it is so expensive.
Yeah.
So $50 per day, by the way,
Okay.
or 100 sometimes.
$50.
$50 to $100.
Okay.
Yes, very expensive to be
Okay,
a guy
I believe
in
you.
America.
Okay.
Yeah, so I end up spending.
Being a woman is expensive too, by the way.
I agree,
We
I agree.
have way more stuff to buy.
Okay.
Come on.
Okay.
Being a woman
Alright.
requires a lot of, especially, again, obviously it depends, but if you're trying to even look normal, like you're taking care of yourself, it's expensive. And then in America, those things are expensive too.
Okay.
Sorry, go ahead.
So I also buy pre-made meals from Factor, which is like a healthy meal
Oh. Yeah, I
company.
heard that.
Yeah, I spend like 140 a week, so that's 560 of money gone there directly, because I don't want to spend a lot of my like headspace in cooking. I don't like cooking personally.
Okay.
Some people do, but like I spend like $560 there, so it's 1,260 plus let's say dates, everything like combined. It's transportation, electricity, whatever. It's 1,500 is how much I spend,
Okay.
and 2,500 is how much I save. So I do end up saving a lot, and then so I'm basically saving down the line close to how much, 30 grand in a year, and I invest that money too in like index funds or
Okay.
whatever, try to grow
That's
that.
good.
Yeah, so but in terms of if you like compare it to like India or where I come from, people like there are people who don't make any money during residency.
Yeah.
They actually end up paying the hospital
Yeah.
because it's like a training. It's
Yeah.
not like you're a
Yeah.
physician,
Yeah.
so it's way better than that.
Yeah.
And I get paid way higher than what the highest compensation in my country for even like federal level institutes would
Yeah.
be. Right, so India has a lot of good institutes like AIMS, which pay like $2,000 a month. But my salary after take-home salary is way higher than that in terms of savings. I would say so. So that's a good part. I actually like the salary structure here. It could be higher, of course. Who doesn't like more money? But yeah, it's good enough. What about perks and benefits? I also wanted to talk about a lot. Like in the US, they give you some academic allowance. They'll give you food money or free food. In a lot of other countries, that doesn't happen.
Yeah.
What about you? What do you get?
Yeah, as that in our program, I can talk about our program. It's really good. We get free meals with every morning report, noon conference, twice a lot of the days.
Wow.
And
Free food.
Yeah, always.
They're feeding you well.
Yeah, yeah, they do. And then there are some social committee things that are like free for you too. You can join. It depends on the activity, but it's usually well organized. And then as far as other benefits like health insurance and everything is, I think, compensated.
Okay, and do you get any kind of academic allowance, like to buy?
Yeah, we do get that. I think there's two of them. One is for like education, just education. And then there's an additional one for meal. We get, I forgot, I think it changes every year, but like $800 per year, we get meal allowance. Like you can go and buy from the whatever, usually cafeteria, that's where we go.
Wow.
But, so additional on top of the free food, we get that.
Wow, so
Yeah.
they're feeding you really well.
Yes, they do. They care about it.
So
Yeah, again, not all programs do that,
Yeah,
but
yeah, I know.
our program.
that's a good thing, because most programs I've talked to, then you don't get free food.
No.
So like that is great.
That's why I chose mine because I like to.
You wanted to be fed.
Yes.
Okay, that's good. So those are like the perks in terms of the food benefits and in terms of academic allowance. Any other benefits in terms of a lot of residencies host get-togethers and they'll end up paying for the get-together, right? Or
That's what I was trying to say. Is depends. Some of them are like paid by the program,
yeah.
but sometimes we just come up with something random and we just chip in money and do it. But there are certain yearly, like for Christmas, for every year meet and greet. That's organized by the program, paid by them. So there are like yearly events like that we don't pay.
Wow. Same. So for us though, like the allowance isn't as high as you. Like I get about $150 every quarter for spending on meals. which isn't like, it's good, like better than a lot of other programs, but doesn't run me through the quarter. So I end up spending some of my money. So $600 a month, a year, $600 a year for like meal stuff. And like our hospital gives good meals. I really like it's healthy. And like then a lot of other cafeterias. So that is something I do like. We get an academic allowance, which is about now it's $650 or something for me, right? Where we can buy books with it. You know that we can't buy laptops or iPads, but in a lot of other programs you can buy laptops and iPads and all. And for me, we have residency get-togethers or wellness days, that's what they call it, where they'll host. We recently had a competition of escape rooms where they made an escape room happen in the hospital, which was so cool. We won. So I got an umbrella. That was my prize. It was a good umbrella. So it was fun. Like we have these like little sprinkles of that. Residency get-togethers where they pay for that. So that's a good perk and like benefit to have. Okay, moving on. How's your residency structure?
In terms of
internal medicine.
Internal medicine, again, it's usually 3 years. That's pretty common. And then first year, and again in ours, is intern year, where you get to be trained more intensely, basically, and you are under direct supervision, basically. And then in that period, there is like obviously there's always expectation for each month, each weeks, depending on how many weeks you have in total. So they ask you to do certain levels of like independent activities, and they expect you to progress, obviously. And then, but usually once you are able to show them that you can function as an independent, technically a little bit more independent under indirect supervision, then you become a senior resident, and then you transition into second year. It's usually that this happens for most people, but there are some cases you can stay longer in the intern year. And again, they will assess you like on a regular basis. And then second and third year are similar to each other. And then obviously at the end of your third year, they expect you to be pretty much independent. And that's what the attending
like physician, a junior attending.
Yeah,
that's
exactly.
What they call it, junior attending.
Yeah, towards the end of third year, they pretty much let you decide everything, and they want you to come up with everything. So
gotcha.
Yeah.
And how hectic is first year versus second year versus third year? Because I know you guys have ICU, which is the most hectic in almost all programs. Is in internal medicine. It's a 3-year residency. So like in first year, I think the ICUs. I have a few friends who are in the ICU, and they're like, wow, 12-hour work days and whatever. And then like it oscillates. Like I know you have ICU week, and maybe it's outpatient then, or it could be you're on the floor plus some kind of outpatient. How does that work?
Yeah, ICU is totally different than floors. Obviously, you have like less patients, but they're sicker, and then your shift is longer.
How long does it
It's usually 12 hours.
Wow.
And then the work hours can change. Every program is structured differently, but ours is 5 times a week, 12-hour shift. And then again, when it compared to floors, again, you have less patient, and I think the work hours is also less, but it's just more intense, like as far as work and emotion.
Yeah,
and
emotionally,
yeah, for me at least, like first I went there, I was like, what is going on here?
Wow, yeah.
And then I was like shocked. Again, the amount of sick people here, like, again, compared to my own country, I've been to ICU in my country too. It's just like the amount of medicine is very advanced. Even though people are super sick, the sense that medicine is so advanced, they can save them. But it is just that emotionally very exhausting and draining.
I agree.
So it's just was way different for me to understand and just get adapted to this. ICU was one of the part of the residency was most difficult for me to adjust.
For you,
yeah.
Yeah, okay. And does it get easier as you advance down the years, or harder for you?
Yeah, obviously easier.
Easier,
you learn as far as medical knowledge, system wise, everything, you just know it better, you feel more comfortable,
Mm-hmm.
and then you learn to turn off those emotions at some point.
Turn
and
off.
don't,
Okay.
yeah.
Turn off the
No,
emotions.
No, you
Are
cannot
you
turn
numb?
it off.
Are you numb? Oh my
Yeah,
god.
I
we-
am that inside.
We need a psychotherapy session
Yes,
here.
I do.
Okay, I'm just kidding. No, I get what you're saying. You sometimes have to put those emotions aside
Yeah,
when you're taking
yeah.
care of patients because they can get in the way. I get that.
Yeah.
Yeah, I completely understand. Also, you guys have electives and maybe selectives. Could you talk a bit about what kind of electives do you get exposure to?
So elective, obviously you choose it. Like you, most of the time they give you options. Each residency and hospital has different specialty that they offer you. It's well structured, honestly. It's usually built between those hard rotations where you feel overwhelmed and you just need a little bit of more easier, like less work hours and general less stress rotations. It depends on each program, obviously, but it's well structured usually.
Okay. In terms of psychiatry, I would say the first year again is intern year, just like you, and at least half of that year is spent doing anything that's not psychiatry related, but more associated with psychiatry. This could be like internal medicine. So we did 3 months of
Yeah,
internal
that's how we
medicine.
met.
That's how we met. I remember those days when it's 5 a.m.
Yeah,
like
rotating
no
for
sleep,
hours.
no sleep, and we were like, okay, hi, you look tired. You remember that? Yeah, 3 months of internal medicine where like it's floors where we met plus outpatient. I think it was 2 months of inpatient and 1 month of outpatient for me, and then there's 2 months of neurology for us and 1 month of emergency medicine, and the next 6 months are like inpatient psychiatry, which could include like just pure psychiatry or consult liaison psychiatry, where consult liaison psychiatry is more working in the hospital as a consult team, where we give our suggestions to medically ill patients who are like have, let's say, cancer and they have depression. So we give our suggestion on what antidepressant would work best for them, right? That's an example of that. In second year, it's the same. We go through like inpatient. It's very inpatient heavy, where we focus on inpatient psychiatry mostly, plus some consult and emergency psychiatry, which was really fun. Third and fourth year are very much outpatient for us. So I know your program oscillates between inpatient and outpatient and for every year, right?
Yeah.
For us, it's third and fourth year, which is purely outpatient,
Yeah.
plus some sprinkling of electives if you want. So there's electives like TMS, ketamine clinics, or ketamine like places which are for treatment resistant depression, ECT, addiction
You guys,
medicine.
yeah.
So addiction medicine is fun. But yeah, like psych in general, in terms of work hours, is pretty relaxed, I would say. It's a 5-day work week in general, which is turns out to be not more than like 45 hours a week.
Okay.
Pretty much relaxed. Sometimes we have calls. We have 24-hour calls. I know your calls are like a bit more relaxed, I would say, till 7, right?
Yeah.
You have a night float system. We don't have a night float system. It's more. And I used to do calls initially, like I think it was every 12 days, and now it's the same. Right? Every 11-12 days, I'm on 24-hour call. That can get to you.
We don't have that anymore. We don't, again, in our internal medicine, we don't have 24 hours. The longest call is 12 hours.
Yeah, but we have post call, like, which is sometimes good. Post call means like the next day it's off, like once you do it. So that's not bad. Like I think it's an okay system. Like I'm fine, like mentally right now. Not numb yet. Not numb yet. Yeah.
Okay.
So apart from that, just also want to talk about like career advancements in terms of what are your plans after you're done? You're in third year. Residency is gonna end soon.
Yeah.
What are your plans?
As I said, initially when I came in, I was more ambitious. Like I was thinking definitely I'm gonna do fellowship, things like that. Now I don't want to do fellowship for now. I need to have a break for myself.
I know.
So again, a residency is not that hard when it comes to work hours. I had way worse expectations, and I'm happy with my program overall. It's not a malignant program, anything like that. But it's just that my expectation of especially the US healthcare system made me decide that I should just take a break and think about what I want to do as far as career-wise, like long term. I know for next year I'm gonna do primary care for at least 3-4 years. That's what I want to do. Make some money.
What's primary care? Many people don't know.
It's a family medicine basically. So as an internal medicine resident, you can do either internal medicine on the floor or in primary care. So you have both options. We are certified to work anywhere pretty much, right? Even hospitalist job have that ICU as their part of work expectation. Some of them expect you to manage ICU patients. So that's why we are getting everything pretty much. So as an internal medicine, you can do both. So I chose the one that has more life and work balance. And
Gotcha. And I know there's also a deal like with 7 days on, 7 days off. What is that about? Like in terms of being an internist, like you can work 7 days.
Yeah.
Can you do that in primary care?
Yeah, no. So that's the appealing part about internists, that that's the reason people choose it, because you have sometimes 2 weeks, 1 week, depending on how you want it. That's something people like, but I don't like that. I like to be regular. I like my routines. I like to have the weekends off, holidays off. I don't want to work 12-hour shifts. Instead, I want to work from 9 to 5.
Fair enough. Like so for
that's what I'm just saying. That's the preference thing. So.
Okay. And in terms of fellowships, what are the most appealing fellowships in the US that your colleagues might be going for?
Yeah, most competitive ones are cardiology, GI, HemOnc is I think competitive too. Let me think. Pancreatic is not that competitive, but I see a lot of like people being interested in that now, and it can become competitive, I believe. And
endocrinology,
not really, it's not competitive. But it's a good option if you want to have like good life balance. I thought about it before. I thought about allergy immunology. That's also nice when it comes to it's usual outpatient. But
in terms of psychiatry, so similar to her, like I'm also thinking of just like not doing a fellowship as of now. I used to think I want a fellowship, but then you'll see a lot of, because with so many things happening in the world, I'm just like, I want a job, peace of mind as of now. I can't be intending for
no, I don't have any.
some money to support myself. Every friend of mine is like now a multi-millionaire, and I'm like sitting so it's time that like I start a job, and at least if I have a family, I need to support them, so I would need that. I'm planning to do more, so either inpatient psychiatry, so you can have like similar jobs like she was talking about, where either you could do inpatient or outpatient. The appealing part of inpatient is like 7 days on, 7 days off. That can be an option. You could also do 5 days a week, right? For outpatient psychiatry, there are options where you can only work for 4 days a week as well, 4-day week, and it's the next 3 days are off, right? So the weekend is off, which is also appealing. There's also jobs in consult psych, which is you work in a hospital where you see, let's say, HemOnc or somebody in cardiology has a psychiatric issue, let's say schizophrenia or bipolar or whatever, and then meds need adjustment, they call us, right? And we have to manage their mental health disorder in the context of them having, let's say, mitral stenosis, or how could that affect their mental health disorder. So that's very interesting. There's emergency psychiatry, where you can work in the emergency wards and basically take care of patients who, it's a shift-based work. So some people just work like 3 days a week, and it's beautiful, right? Like shift-based work, which I like. So emergency psych is something I'm thinking about as well. But so psych is a 4-year residency. So unlike you, I have to work another year. The good old work.
It's not about the working. It's just, again, I personally also believe in more primary care. When it comes to managing chronic illnesses, I believe that's the also field that I can help most to prevent the illnesses. So again, everybody has their own preference, and then you will have time to decide, and then. But so for you, you have 1 more year. But we are also more like type of people who believe in like you have to have your own. Like I want to have my own company, some sort of like independency at some point, where like I am my own boss. That's my end goal, basically.
End goal is build your own company.
Yes.
That's good. Me too. Yeah. Just in terms of the fellowships in psych, I also just want to talk about, there's consult psych, where it's a 1-year fellowship that you can do. And there's child psych, which is a 2-year fellowship. That's more appealing. Some people can accelerate from 3rd year, right, directly into child psych, where the 4th year becomes a child psych year, and the next year is like 1 more year to child psych. That is the most appealing, somewhat competitive. The rest, I think, is geriatric psychiatry, which is like taking care of people who are like 65 years or older. And that's basically psych. But the fellowship part in psych isn't huge, unlike like internal medicine. Most doctors actually don't end up doing fellowships, because you can practice a lot of this fellowship stuff without doing that fellowship. So that's interesting. So other than that, just also let wanted to go into what are your thoughts about like adjusting to the US in terms of you are from Azerbaijan, right? Did I pronounce that right? Yes, I got that. Do you think like what are the difference in terms of like culture, in terms of that were hard initially to deal with? Were there any like problems you faced in like coming to the US, if you want to talk about that?
Yeah, obviously it depends on which culture you're coming from. I am more like I would say Eastern Europe, Asia, my country, that's where it's located. So there's a lot of difference when it comes to cultures. But I personally always felt like I belong here more than my own country.
Wow.
So I didn't have a lot of issues when it comes to that. So again, it's a person dependent thing. So I am just telling my own experience that everything was okay for me when it comes to that.
In terms of like me, I think culturally one of the shocks that I got was like the loneliness sometimes you can feel here. And it's not that it's like an act. So the way I describe it, it is like a passive form of loneliness. So here you have to go out of your way to socialize, right? Sometimes like you have to be the kind of person who socializes to not be lonely. But in India, like there's so many people, there's everyone's always there, right? So you don't have to make an effort, right? So here I think it's more so if you're more passive, you get lonely. There, if you're passive, you don't get lonely, I tend to isolate, which was hard on me, like in terms of not, like you spend days here without seeing people.
Yeah, that's true.
That's wow.
But in my country, we are 10 million. We are not like as much as you guys. We are not that crowded. But I know what you're saying when it comes to culture, like people are just more in each other's life more in my country. I personally didn't like that growing up.
Like that.
There's also plus to it too, which you don't feel lonely. You always feel supported somehow. So again, it's just the balance thing. It depends on what you like.
That to me. And secondly, in terms of like finding a partner, which that sometimes can be a bit harder in terms of which kind of state you're living in. Like in New Jersey, there's a lot of Indians. So like sometimes here dating is like culturally bound. You'll see there's Indian dating apps, there's Muslim dating apps. So if you end up in a state where there's not maybe a lot of people of your ethnicity, it gets harder to date, I will say sometimes. So you're dating cross-culturally, which I really don't mind that, but it sometimes can be an issue if the other side minds that. So that was something I had to adjust to, I think. But otherwise I really like the US culture in terms of you're free to do anything, especially if you go to New York, you can just like anything in your mind, no limits, which is a good and a bad thing, but that's a good thing. And also US is also a very individual based culture rather than a group based culture. So India is like very group based, like it's all about the family, the group, and am I doing this for the group or myself? It's more about the group. Here it's all very individualistic, which is a good and a bad thing. A good thing because being individualistic makes you live up to your own values, not your family's. Like you're not living their dreams, you're living your dream. But that can also get you to become very lonely because it's all about you sometimes, right? So that was another kind of culture shock. Okay, in terms of compensation wise, like the jobs that you're looking at, what's the compensation generally like they offer to internal medicine physicians right out of residency?
It's good. There's always misconception between internists and family physician. They're pretty much the same. It will just depend on the location and what are you looking for as far as work hours and population. So that kind of plays a big role. But otherwise, I would say the lowest is like 250, maybe 220 as a new grad, both internist and primary care.
What's the highest you've seen?
Yeah, I got an offer for like 400K, but it's just the location that I don't want to go. So.
Okay, so generally like if it's not a city or if it's like very far away, it tends to get higher. Because they don't have as many as providers, there's not as much as competition. The supply is lower than the demand basically. So that's basically what you've seen. For me, the kind of offers that we've been getting, at least in psych, the lowest again, like similar to you, I've seen like 250. The highest I've seen is like 750. Like California pays wow. Right, so if you work in California, but then the tax is crazy too, right? But here, the benefits of psych though is you could make about 350K working like 4 or 5 days a week, right? Which is beautiful. Like you get your weekend, and the workload on 4 days isn't that heavy. Like inpatient and outpatient, Right, 450, and plus do you get bonuses or no? Do they offer?
Yes.
How much is the bonus?
It
like?
depends. There's sometimes retention bonus, but there's sign-on bonuses, things like that. And it varies a lot, so I cannot give one number.
What's the highest bonus you've seen?
100.
Wow.
Yeah.
I think I've seen, my highest I've seen is in California, 200 bonus. With like the base, so that's 550, which is crazy. But then the taxes. So
you still pay tax on that too.
Lastly, just also talking about in terms of, do you ever feel about like quitting medicine? Because you'll see so many doctors, that thought ever come into your mind?
Yeah, as I said, I was disappointed when I came in. Again, my residency, no, not when it comes to my residency, it's not even about the residency program, how it is structured. I personally can say mine is not malignant, and then they cannot even, that's the thing I'm trying to say, is that they cannot really manage the fault of healthcare system, which is almost like inherent now. So I thought about quitting a lot, just because I am a type of person, I like to be rewarded with what I do. Again, as I was being honest, money is important always, because you need that to live, but I also need other internal motivation apart from the external motivation.
Correct.
Which is money. I need to feel like I did a big difference.
Satisfaction.
Yes, exactly. I have to feel like I did help them. I really did do something useful in their life. And if I don't have that, then I will be like, I don't want to do this. I don't want to keep doing this, at least. For moments, I questioned that. I was like, did I really make the right decision? I went through all this process. I spent a lot of money on this journey, not just the money, but like energy and the time. As you said, if we spend this in my own country, I would have been like rich right now. I have really nice living. So I thought about those things, and then I was like, but I still think that it was worth it. That's my short answer.
So yes,
because I like to do things like I would rather regret. I would rather be like, okay, I did a mistake, but I would rather do it than regret not doing it at all. And at the same time, there are as I said, I learned a lot through this journey, medical knowledge, personal skills, everything I gained through this whole experience. And I do believe that it made me a better person, and I'm mature now because of this. And I don't know, I think I'm glad that I did it. I met my husband here. I met a lot of good people. My co-residents, I met a lot of friends here. So I think it's a worth journey, but just keep your expectation more realistic.
I agree, like setting the right expectations. I don't like when we come, like we idealize this country like anything as immigrants, which I think is the wrong thing, because then we don't, like, it doesn't meet that expectation, and then we are like, okay, this is it. Right, that I think happens to every immigrant doctor, is when they come, they're like, oh my god, this is like the next big thing. Wow, look at where I got. But then you see, okay, this system is also in some ways broken, although less broken than many other systems, I would say. The pluses, again, like we discussed, the compensation is a big plus. There's other, like cutting edge healthcare in many fields is a big plus. They have so much good technology. The facilities are very well built, I would say. And also, like in terms of residency perks and benefits, and the training is good in many ways.
Yeah,
the education,
definitely. Better than my country. I can say that, definitely.
The education level, or the education of a doctor in the US, like things, the amount of knowledge they have, I think it's intense. Like, and the critical thinking that you need for USMLE, I think you don't need for a lot of exams. So the cohort of doctors you get here are very smart, I personally think, at least in the US, which is like, you can't go wrong with doctors here.
Yeah, exactly.
The cons, again, I would say, is like just adjusting to a different culture. The healthcare system sometimes can be too complicated. I think you put that beautifully. I couldn't have put that better myself. Like, you just don't know. Like, you're always learning. Like an attending doctor, 10 years down the line, also doesn't know things about the healthcare system, and they're like, so you're always learning, but that is a complication. It gets too complicated and you don't know what to do sometimes. I definitely agree. The insurance is something that can be more dominant here. Like insurances can have a say on, hey, this is the medication that you can give to the patient, this you can't, this is something you can't prescribe or not, which I think is a problem sometimes, and they can override you as a doctor sometimes. You can fight them, but still I think that doctors should be being like sayers in what medication they want to give to the patients, right? And other than that, I think some dating issues going on in my life. We'll talk about that
later.
In another video. All right, but yes, USMLE was definitely worth it. I think it transformed me. Made me learn how to deal with uncertainty, right, and brought me a lot of success, right. And by the way, Ulker, thanks for coming to the video. Where can they find you?
Oh yeah, so I have my own Instagram and YouTube channel also. My current name for Instagram is ulkar.md, and on YouTube I just have my own name, Ulkar Carothers MD. So you guys can find me. I do post different topics usually. Mostly I'm very, as I said, I believe in more preventive medicine, and I do share some useful information if you guys wanna check in.
I'll mention the links below. You can find Ulker and you can text her also. Like she can guide you a bit.
You guys can ask me about other questions when it comes to residency and things like that too. I will be more than happy to help if I can.
Okay, and let's do a second episode, like maybe a year down the line once you're a full-fledged doctor, and see how things change. Right?
I will be richer than you.
Yeah, she will be richer than me. I'll be a resident, and she'll be making bank. Yeah, so that's why you should take internal medicine over psych. I'm just kidding.
No, you will make better.
We'll see. Let's see. Unless I quit medicine. So guys, thank you for watching, and I hope I'll see you in the next one. Take care.